Lord. It's called Team on 105.1 The Buzz. Dari, Mitch, and Ted show. Let's welcome to our show, cosmetic surgeon, Dr. James Chan. Hello, fine sir.
Hi, how are you?
If you're new to the show and new to Dr. Chan, he's a double board certified facial plastic surgeon. He specializes in the areas from the neck up.
Oh, Mr. Fancy Pants, they call him.
It's your upper and lower eyelids, your face and neck rejuvenation, nose and ear reshaping, lip and chin implants, facial scar revision. Basically just makes you look a lot better.
That's right.
And we want to talk a little bit today about noses.
Mm-hmm.
And if you've been watching any basketball lately, you've seen LeBron James wearing this frightening looking mask to me. Sometimes it's clear, but lately it's been black.
Yeah.
Because he has a broken nose,
I've
I
only
guess.
seen the clear ones. They
No,
are the ones that are...
Look at my screen. That's like...
Sounds like Batman.
Yeah, it's pretty scary. It hasn't affected his ability to play, though. He scored like 60-something points the other night.
Yeah.
Well, you assume that it's him.
So once you have a broken nose and you're a basketball player, you have to wear this?
Well, you have to wear something to protect that nose if you want to play. Ideally, you don't play anything for about 4 weeks, but, these guys aren't going to sit out for 4 weeks, so they get one of these masks and they keep playing. But broken noses are really common. The most common facial fracture that we see, and it's very common, especially in basketball. I mean, we see it from sports injuries, basketball, baseball, football.
And for non-sports related, what's the most common cause?
Usually bar fights.
Really?
Yes.
Ooh.
Well, that's how I broke my nose was a fist fight. I got punched in the face.
But not really in a fight,
hard.
right?
Well, no. You see, I live a different kind of life. It was a choreographed fight for a sketch comedy show. And we were rehearsing it for the first time. And the gentleman who was my fight partner was a very, very, very large gentleman. He was his name was Andy Lindbergh. He was a guy who actually played Lardass in Stand By Me.
Oh, wow.
Very large guy. Grew up, that was when he was a teenager. He has grown up to be a very large man, very powerful man. And he was just kind of loose hand, kind of doing these fake punches. And it was a thing where he would punch me in the stomach, and it was very cartoony, and I would lean over, and then he would swing from below, and it would punch me back up standing. And so we did that a couple times, and I thought we were stopping, and he thought we were going. So I was bent over, and he brought his hand right up into my nose. Huge pop, flood of blood, all that stuff. They took me to the emergency room, and by the time we got to the emergency room, it had swollen up enough that they couldn't do anything about it.
Right.
So they had to wait till the swelling went down for a few days. So I had to work and go about my life with this nose that kind of came down to the bridge and then moved over about a centimeter and then kept going with a little bit of bruising around it. And then after a few days, I had to go back in, and they basically rebroke it, rebuilt it.
Ugh.
And all that. It was extraordinarily painful.
So, Dr. Chan, if you have taken a blow to your nose, do you immediately go to the emergency room, even though they may not be able to do anything right away?
Yeah, so the idea is that you want to get in to see a specialist ideally within the first 2 weeks.
Yeah.
You can let the swelling go down after a couple days, but you want to get in there within the first 2 weeks because the bones are still mobile and you can push them back into place and set them.
Well, that's how I knew it was. Everybody was asking me, like, is it, I went into the bathroom kind of cupping my hand under my nose and bleeding over the sink and just ruined that bathroom with blood and grossness.
Hooray!
But I heard someone yelling out from out in the rehearsal area, like, is it broken? And I reached up and pushed my nose over a little further. I was like, But you could hear, I mean, because when you have that much pain, your body takes care of it. My face went numb.
Yeah.
I didn't feel anything. So I could just sit there in the mirror and push my nose back and forth, which
Yeah,
was delightful.
Most of the time, it's pretty obvious that you've broken your nose. And if you go to the emergency room, they may not do anything. Sometimes they take x-rays. A lot of times they don't because it's pretty obvious.
Yeah.
But the main thing is the timing. You want to get in to see a specialist within the first 2 weeks so that you can get it fixed if it's something that needs to be fixed. Now, what happens if you don't? Your nose is going to heal probably crooked, and you'll probably have some trouble breathing. And we see that a lot, too. People have broken their noses a few years ago, and now they come in, they have a bump, or they can't breathe, they're snoring, they have chronic sinus infections, all that kind of stuff. And it can still be fixed, but it's a little more involved. Usually you have to re-break the bones and you have to reset everything, and so it's a lot more complicated.
Well, for me, I've always had a bump in my nose, so this just finally gave me reason. Like I used to, before I got it broken, people would ask me if I broke my nose all the time, and now I can say yes. It was
So
nice.
it looks different than it did before the break?
Very little. It's actually the way it kind of I'm not looking at mirrors, so it's confusing, but it kind of pushes to one side or the other.
Yeah.
And it used to go the other way.
Oh.
Huh.
So I could just
kind
punch
of
you.
reset.
I
Yeah,
can help
it's
you
just
out.
kind of like I've always had a slightly crooked nose and always had the little bump there, but It now is just a little bit different.
So,
Yeah.
so as a broken nose, is it common to have breathing problems afterwards? I guess it probably would be.
Yeah, it is very common. In fact, when we see people with breathing problems, the majority of the time they've had a broken nose at some point in the past, whether they knew it or not. Sometimes they had it when they were a kid and they didn't even realize it. But
Right.
it's very common to have breathing problems, deviated septum.
What exactly is that? You hear that so often in high school. Anytime somebody had a nose work done, they said
Yeah.
because of a deviated septum.
Right. So your septum is that wall that divides the right and left side
Okay.
inside your nose.
All
It's
right.
that cartilage
Which,
and
by the
bone
way, I
piece.
have none. My septum is as deviated as septums get.
So the reason
He's very impressed.
the reason a lot of people say, I'm having my septum repaired, a deviated septum repaired, is because a lot of times insurance pays for that. They pay
Right.
for anything that's related to breathing, so sinus infections, deviated septum, that sort of stuff. And then on top of that, a lot of times people want their nose to look better, so
Right.
we will often combine it with those
Right.
other surgeries.
Well,
so
you're in there.
exactly.
Yeah.
And the insurance will cover the part that's related to breathing, and then the other part is still cosmetic. And
But a lot of the setup, a lot of the cost of getting in there and getting
Exactly.
things going is taken care of already.
exactly.
Yeah, I've had a deviated septum pretty much my whole life. I don't know if it's
So you
just
mean you
something that's
could stick a
genetic or what.
Q-tip in?
Oh, I can touch. If I put my fingers up in my nose, I can touch my fingers together.
Is that
yeah.
bad, Dr. Chan? Should he fix
Well,
that?
when I got my nose broken, the doctor at the time was like, "Between you and me, do you a lot of coke?"
Oh,
I
I
was
thought
like,
it was
I was
drug-
like,
drug
"No, I
use."
don't. Never in my life ever." He's like, "Really?" I'm like, "Really? Like, take a blood test. Never, ever, ever." I was like, "I don't know what can cause it." He's like, "Yeah, I don't know either, but you have no septum,
Huh.
and I don't."
Yeah, and sometimes people get whistling when they breathe through their nose. I don't know if that happens to you.
I don't.
but,
I snore like a bear.
uh,
That's for sure. But
yeah.
that's about it.
yeah, so yeah, a lot of times when people come in for cosmetic rhinoplasty, it's because they can't breathe, and that's their primary concern.
And again, as you mentioned, it leads to snoring, and it could be sleep apnea, which can be very dangerous and certainly cause all sorts of health issues. So you want to get it taken care of.
Absolutely, sinus infections, all that kind of stuff can be related to broken noses, deviated septum.
And a rhinoplasty, is that something you can get done in a day and you leave that day and you go back to work a few days later? Or
Yeah, so it's outpatient surgery. You don't stay in the hospital. You go home the same day. However, you're probably going to have a cast over the top of your nose, and depending on how much work is done, you may have black and blue eyes. So generally, I tell people about a week.
how do you put a cast over your nose?
There's a special moldable cast that you can put over the top of the nose, and you tape it down.
So it's a little bit like LeBron's mask, I guess, to make sure nothing touches it while it's healing.
Exactly.
Yeah, you don't want anything to touch it while it's healing. It hurts real bad.
And then in most cases, how soon can you go back to work and no one's going to know you've had anything done? Depends on
in
how
a-
you bruise, I guess.
Yeah, in about a week. Usually a week, you're pretty good to go back, and very few people will know unless you really tell them I had something done.
Yeah. And is the price range just completely different for everybody, just based on what's going on inside your nose and what you want done?
Rhinoplasty probably has the widest range of prices because it can be very simple, just filing down a bump, all the way up to complete nasal reconstruction. So the price can range. Plus, sometimes insurance can cover part of it because it's a breathing issue. So there's a lot of variability there.
And I'm sure, like most of the cosmetic procedures, all the cosmetic procedures you do, when someone's having rhinoplasty for cosmetic purposes, less is more. You probably have a very light hand as you do it. Did you watch the Academy Awards? Do you watch the celebrities and think, wow, that's too much of a nose job, too much of a nose job?
I saw some of it, and I did see some interesting work done out there.
Poor Goldie Hawn.
Yeah.
What'd she do?
Yeah, it doesn't make
What'd
sense.
she
When
do?
you have plenty of money, so you can find the best surgeons. You can come to see Dr. Chan in Portland.
Yeah.
But
some of
yeah.
them.
Well, that was her big mistake, right? She didn't.
Didn't
She
come
didn't
see
come to
Dr.
you. That was
James
it.
Chan. For more information about
Listen
Dr.
up,
Chan
Hollywood.
and his practice, which is called Revion's Portland, just go to drjameschan.com. That's drjameschan.com. You can schedule a free consultation, check out remarkable before and after pictures, learn about financing options. You can learn all about Dr. Chan and his amazing accomplishments. He's a very smart man. Again, that's drjameschan.com. Thanks so much.
Thank you.
Thanks for talking about Ted's hideous nose.
Yay!
Yay!
Thanks, Ted.